Congressman Price, I want to start with you. You know, this is basically being done by the Democrats without Republican support for the most part with this procedural reconciliation procedure that's happening. At this point, is it best just to kind of go along for the ride and work on health care down the line after it passes?
Well, it's being done completely by the Democrats. There are no Republicans involved, haven't been involved behind closed doors for a long, long time. But it's not whether or not the Republicans are being shut out. The fact of the matter is the American people are being shut out. They've said 2 to 1, 3 to 1 that they don't want this bill. They don't want the increase in costs that they will see. They don't want the increase in taxes that they will see. They know that it's going to decrease the quality of care, and they know it's going to decrease access to care. So there's nothing that the American people want that's in this bill. The fact of the matter that as a physician, we know that there are positive solutions that we ought to be putting in place that can get folks covered, that can solve the insurance challenges, and address the lawsuit abuse issues which aren't addressed in this bill, in the Democrat bill, at all.
Right.
So the American people are frustrated because they don't see positive solutions in this bill, and they know that they exist. They want to start over.
Congressman Yarmuth, I mean, you know, look, 30 million people will be covered under this bill. Those are the projections, but none of this starts until 2014. The other issue that we're seeing today that's come up...
That's not exactly true, but go ahead.
Okay, well, no, feel free to correct me, absolutely, fair and balanced. But real quick, you know, the cost issue keeps coming up over and over. The Democrats are telling us that it's going to reduce the deficit, but yet the deficit is still going to be going up by $1 trillion. It is right now each year. So how do you respond to the cost concerns of this?
No, it's not the Democrats saying this. This is the CBO, which is nonpartisan. The CBO said that this plan will reduce the deficit by $130 billion over the next 10 years and $1.2 trillion over the following 10 years. So there's no added cost to the Treasury from doing this, or to the taxpayers. The only people who are charged more under this plan are people making over $250,000 a year on investment income, which they now don't pay anything on Medicare. So if you're Warren Buffett and make $300 million a year just in dividends, you don't pay anything into the Medicare tax right now, in the Medicare fund, and you're getting all the benefits. So that's how we pay for the lion's share of this bill.
Well, the fact of the matter, Cheryl, is that the way that they pay for it is to raise taxes $500 billion on the American people. Folks that make over $250,000 a year are small businesses. Those are the job creators across this land. They will destroy jobs with this bill. They're also slashing Medicare by $500 billion, decreasing the Medicare Advantage, the wonderful choice portion of Medicare, and cutting Medicare by $350 billion. You can't do that without rationing of care. As a physician, I know that. John ought to know it, and so should his colleagues.
Well, let me tell you something. Yeah. Tom talks about being a physician. I'm a small business person. So are my brothers, and so is my father. This tax, this added tax, won't have anything to do with small business people. Small business people aren't affected by this.
But Congressman Price, but isn't this in violation of the Byrd rules, which says you can't touch Social Security with the Medicare tax and, you know, hitting investment income? I mean, Bill Clinton didn't even try to do that with Hillary Care in the mid-'90s. Isn't this in violation of the Byrd rules, reconciliation, where Social Security should not be touched, Medicare should not be touched under those rules?
The Byrd rule is a Senate rule, and I'll leave that to the Senate folks to decide. But what I will say is that the constitutionality of this is really in question. Whether or not it's through the reconciliation process or whether it's the individual mandate dictating, having the federal government dictate to each and every single American that they've got to purchase a certain service defined by the federal government. I think that's probably unconstitutional on its very face. So there are real problems within this bill that remove the ability of patients and families and doctors.
Congressman Price, are you going to mount a challenge? You're not the first person to bring this up.
He's become a constitutional lawyer now, too, in addition to his medical degree. Look, we're very confident that this is not only constitutional, we're confident the American people will love this bill. It's great for small businesses. It provides subsidies to help small businesses provide insurance for their employees. This is the biggest portion of the uninsured right now, small business people.
I got to say that,
John's
Congressman
been going to Alice in
Yarmuth.
Wonderland too many times.
Oh, you two are like a comedy show right now. Look, Congressman Yarmuth, I have to tell you, but in all honesty, you know, if you look at the polling by the American people, they're actually not for this. I mean, a lot of them have come out against health care. I mean, that's our polling shows us that.
if you look at, there's an Ipsos poll out just this last week that they asked people finally, those people who are against it, are you against it because it doesn't go far enough? Almost 40% of the people said that's why they're against it. You add that to the people who are for it, you've got 60% approval for what we're doing, or even more reform.
They had to dig deep for that one, Cheryl. We're willing to take this message to the American people because we know that the people across this land don't want a government takeover of health care. They don't want the increase in taxes, and they don't want the decrease in quality that they will see with this. And what we'll see over the next number of months is the American people stand up in righteous indignation to what's going on right now.
People want health care security, and they want to know they can afford it, and it will be there when they need it, and that's what this bill provides.
A lot of details to go over, Congressman. My colleague Jerry Willis is with me here in studio, and she wanted to hop into this.
Yeah, I guess, you know, every time I see Congress get its hands on a consumer issue, whether it's credit cards or whatever, the reality is that there are unintended consequences that nobody ever expected that cropped up. And when you look at this bill over 2,000 pages, we really haven't seen it yet. So many things, you don't know how this stuff is going to act together or not act together. Tell me, what kinds of things are not even on the table yet that could happen because there's so many complicated wheels within wheels with this bill?
Congressman Price?
Jerry, we learned last night that there is a group of private individuals, private nursing homes in both Virginia and North Carolina who have found a portion of this in this 2,700 pages that will tax them $19 million in 1 year alone, that will bankrupt their company, throw 3,500 workers out of work, and decrease the availability of seniors to have long-term coverage in those nursing homes. Those are the kind of unintended consequences. Not that anybody wanted that to happen. Those are the kind of unintended consequences that we believe will be in this bill should it pass.
Fair and balanced, Congressman Yarmuth.
Well, I mean, I don't know about the specific provision he's talking about. We haven't heard from any nursing home organizations about that. What I do know is what the unintended, what the inevitable consequences of not acting are. We're seeing it now: 38% premium increases in California, up to 60% in Chicago, 30 to 40% in my district, and Medicare is going to go bankrupt in 5 years. We know what the consequences are of not acting.
Can I just ask Congressman Price a quick question? Because this is, as Jerry Willis points out, an Enron-style bill. It's so complicated. It's as complicated as Enron's financial statement. Aren't 15 million to 18 million people being put through Medicaid through this bill? In other words, that will stress out the Medicaid system and stress out emergency rooms because a lot of doctors don't want to take Medicaid patients.
Well, it's not that they don't want to take them, it's that they can't take them because the reimbursement, the payment for Medicaid services is oftentimes less than the cost of providing the care. 40% of the physicians in this land refuse to take new Medicaid patients because of that cost. 65% of the specialists. So you're going to throw 15 million individuals into the Medicaid program. They're going to have a card that says they have access to care, but in fact they won't have any care at all. And that's the fallacy of this bill.
Well, in fact, what Tom ought to know is, all right, this bill actually equalizes the payment for under Medicaid so that they will have access to physicians and that the physicians will want to treat them because they're being compensated fairly.
All right. Well, gentlemen, I got to tell you, a lot of the states across this country might take issue with this whole bill. Get ready for that one, both of you.